Hi, my name is mchauvin, and my presentation is going to be on the Louisiana Organ Procurement Agency. LOPA is a nonprofit organ and tissue recovery agency that was established on April 1st, 1988. It's funded by the Centers for Medicare and Medicaid. It's responsible for two main tasks, which are housing and maintaining the Louisiana Donor Registry and recovering organs and tissue for transplant. Registration to be an organ donor is very easy. Usually whenever you get your state license or ID, they ask you if you want to be an organ donor or not. And also, you can go and register to be an organ donor on the LOPA website. Those who are donors are usually those who suffer from a traumatic brain injury. And there are certain steps in the organ donation after the death. First, the physician and staff works to save that patient's life. Then brain death has to be declared by the physician and confirmed. Then LOPA is contacted, or the state's OPO, which stands for Organ Procurement Organization. Once that's done, the OPO sends a representative to discuss the donation process with the donor's next of kin. Then paperwork is finalized and the OPO assumes care of the donor. Up to 6 organs are matched for potential recovery. Then, once the organs are reserved for a patient or recipient, the donor is brought to the operating room for recovery. The donor is prepared for the funeral, and it doesn't stop there. After that, usually the OPO or LOPA, they'll do follow-up and support care with the families of the donors. Certain barriers can be experienced whenever we talk about organ donation, usually with the hospitals and with the families. With the hospitals, it could be late referrals to the OPO or LOPA, or it could just be failure to communicate. And with families, it's usually that they have misconceptions about the organ donation. It could be from just thinking that it's unfair how the organs are distributed, or maybe they might think that the recipient is going to abuse that organ, or they might think that it's just too gruesome, or they might think that it's superstitious and wishing bad luck on the ill patient that is going to be donating the organ if something would happen. I related this topic to the cues and competency of teamwork and collaboration because I think that a lot of collaboration needs to occur between the hospital and these agencies like LOPA to be able to give these donors and recipients the best care possible and the best outcomes possible. For my BSN Essential, I chose the one dealing with communication and collaboration to improve patient outcomes, mainly because, as I said before, with the barriers in the hospital, usually it's because of lack of communication. And I feel like if that can be improved with, the communication between the hospital and the Organ Procurement Agency or LOPA, that the patient outcomes could be greatly improved for the donors and the recipient.